am Dr. Kathryn Edwards, the allergist immunologist here at Penn Medicine BeckerENT. So the triggers for allergies will depend on what the symptoms are. So environmental allergies like pollens, trees, grasses, weeds, molds, and indoor things like pets and dust are going to cause more allergic rhinitis or inflammation of the nose and upper airway. In terms of anaphylaxis, or a full body allergic reaction, you see more drugs or foods and stinging insects like bees and wasps that can trigger those symptoms. And contact dermatitis or an allergic reaction on your skin is often due to metals, cosmetics, or chemical products. Bad allergy symptoms can vary from patients who have seasonal type allergies, often will get runny, stuffy nose, itchy, watery eyes, can have asthma symptoms that flare, wheezing, shortness of breath, and that can be from mild to debilitating. And anaphylaxis is a full body allergic reaction, will present with hives, trouble breathing, throat closure, vomiting, low blood pressure, and that can be fatal. So we don't know what causes some people to have allergies versus others. There does seem to be a genetic predisposition since allergies tend to run in families, but we don't have the exact gene or know the exact reason. So allergies can't exactly be cured, but we can do stuff to treat allergies. So allergen immunotherapy or allergy shots can help desensitize patients to their allergies over time. And some patients will report that they feel like their symptoms are completely resolved, but it does vary from patient to patient how much improvement they get. Venom allergy shots, if somebody's allergic to stinging insects like bees, we do recommend that patients be on allergy shots for that, because 60 to 70% of the time, once they've had an allergic reaction, they can have a repeat allergic reaction. And if we do shots against the venom, that will reduce the risk down to 3%. Food allergies, there's a lot of studies going into looking at immunotherapy really through the oral route, not shots, to try to treat people with persistent food allergies, but right now it's not FDA approved, and a lot of studies are still kind of looking at the exact protocols they need to use. Some patients will outgrow their allergies to foods like milk and eggs specifically. About 90% of kids will outgrow those, but we're still looking at more research needing to be done on a lot of those topics. So allergies tend to, or at least seasonal allergies, you're going to follow a specific pattern. It starts at the beginning of a season, lasts for weeks to months, and it's going to reoccur every year at about the same time and may get worse each subsequent year. Ultimately, the only way to really know is to do testing, especially for somebody who has more year-round allergens like pets or dust mites, because they're going to have symptoms throughout the year. Food allergies, we tend to see also a pretty common pattern. Patients will eat a food and have a reaction like hives, trouble breathing, or vomiting within 30 to 60 minutes of eating the food. But we still recommend testing to confirm that allergy, or if there's any question of what specifically was eaten that could have caused their symptoms. Allergies can get worse at night, primarily if somebody has a year-round allergen like a dust mite or a pet exposure, and then they're coming home and having that exposure at night. There is some possible correlation with our cortisol levels. So our natural body's cortisol levels drop throughout the day. So symptoms may increase in the evening compared to earlier in the day when your cortisol level's higher. A lot of patients want to know if they can stop their allergies. Avoidance is obviously the first line, but that's really hard to do, especially if it's a pollen allergy. You can't stay inside all the time. Sometimes you can do dust mite or mold mitigation efforts within the house, and if you have a pet allergy, you can sometimes avoid that. But generally, most people are going to need some type of medication, so we use a lot of oral antihistamines like Zyrtec, Allegra, and then some nose sprays like Flonase. Ultimately, allergy shots are a unique way that allergists can help. We're trying to really induce tolerance in the body and change the way the body's responding to those allergens over time, desensitize so that the body doesn't overreact to those allergens in the environment. That does take time to do, so we're talking weekly and then monthly injections, but ultimately the goal is to minimize the number of medicines that you need, and a lot of patients can actually come off most of their allergy medicines. And in young kids, we can actually prevent them from developing asthma if they're predisposed An allergy could kill you if it's to food or drugs or stinging insects like bees or wasps. In terms of seasonal or pollen allergies, we have seen fatal reactions related to asthma. Patients whose asthma is triggered by such as a pet, and their asthma becomes out of control. About 3,500 people die from asthma attacks in the United States every year. So allergies can act up periodically based on exposures, and some people will call it like an allergy attack. You'll see increased runny or stuffy nose, itchy, watery eyes, maybe sneezing fits. Patients with asthma have wheezing, shortness of breath, chest tightness, or maybe a persistent cough that can develop. So I have been asked on occasion if there's any foods that people can eat to try to reduce their seasonal allergies. There are some studies that show that Mediterranean or Okinawan diets can help with asthma patients to reduce wheezing. And those diets focus a lot on fruits and vegetables, reducing fatty meats, usually lean meats, minimal amounts of dairy, and using a lot of the fats based off of plants. But there wasn't any good study showing that it actually reduced allergies or eczema type symptoms. In terms of foods, there used to be a thought that we needed to avoid a lot of allergenic foods in patients below the age of 1. But now most of the data shows that we need to actually introduce those foods early on, as early as 6 months. So the recommendation is to start introducing peanuts and shellfish as early as 6 months, unless the patient already has a known food allergy or if they have moderate to severe eczema, in which case that decision should be made with an allergist of when to introduce. We look forward to seeing you and helping you with any allergy concerns you may have.